Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained refractive and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to my channel by Eye Surgeon. In today's video, I'll review the treatment options for presbyopia, aka the need for reading glasses that starts for many people in their early 40s. I will go over the cause of presbyopia, the latest FDA-approved Vuity eye drop, as well as surgical treatment options that are currently available in the US. If you don't have time to watch 10-minute videos, you can follow me on Instagram at Dr. Audrey Tai for short, fun videos to learn more tips to care for your eyes. So what is presbyopia? Presbyopia is the decrease in close-up reading vision that occurs in our eyes as we age. As you age, you may start to notice that reading small or fine print becomes more and more difficult over time, and you may find yourself holding your reading material further and further away. Eventually, you may need over-the-counter reading glasses, prescription bifocal glasses, or multifocal contact lenses in order to be able to read small print. If you are affected by presbyopia, you're not alone. Presbyopia affects 128 million Americans, and the number continues to grow. So what causes presbyopia? The lens in our eye is flexible and is designed to change shape when muscles in our eye, called the ciliary body, contract. It is the ability of the lens to change shape that enables us to see objects clearly at different distances by changing the focus. When the lens shape is more curved, the eye becomes more nearsighted, thus enabling us to clearly see objects that are close to us. The reverse happens when we look at objects further away. As we age, our lenses gradually lose their flexibility and no longer change shape when our eye muscles contract, causing presbyopia. Although currently there's no available treatment to restore the elasticity of our natural lens, there are several effective presbyopia treatments to get around this limitation. I have no financial interest in any of the treatments that I mentioned in this video. All of the treatment options I review for you in this video are based on my own clinical experience and study. Recently, a lot of my patients have been asking about the newly FDA-approved Vuity eye drop made by Allergan. Vuity is a prescription eye drop that contains 1.25% pilocarpine as its active ingredient. Pilocarpine temporarily improves near vision through two mechanisms. First off, if your lenses still have any residual elasticity, pilocarpine will stimulate contraction of the ciliary body muscle to shift your eyes into a more nearsighted state, as I mentioned earlier, temporarily improving near vision. The second and main way that Vuity affects near vision is by stimulating the parasympathetic muscles in the iris to constrict the pupil, which creates a pinhole effect. You have likely experienced the pinhole effect yourself when you go to your eye doctor's office and have your vision checked with one of these. This is called an occluder. You may have noticed that when you look through one of the small holes with the flap down, you see more clearly. This phenomenon is called the pinhole effect. Pilocarpine constricts the pupil size, causing a pinhole effect. Pilocarpine was initially approved by the FDA in 1974 to treat glaucoma, or to constrict the pupil when needed for eye exams or eye surgeries. Vuity contains 1.25% pilocarpine, and it was recently approved by the FDA in October 2021 for the treatment of presbyopia. It is dosed at 1 drop in each eye once a day. According to the clinical trial data from Gemini 1 and 2 studies, the effect of near vision improvement from Vuity can be seen as early as 15 minutes after applying the eye drop and can last up to 6 to 10 hours. However, there are some potential side effects of Vuity. In the Gemini 1 and 2 studies, patients reported eye redness and headaches. Using Vuity may also decrease night vision by reducing the amount of light entering your eyes at night through a small constricted pupil. So you may need to be careful when using it at night. Pilocarpine can also rarely cause retinal detachment, so it is important to consult with your eye doctor if you are considering using Vuity. At the current time, Vuity is not covered by most insurance, and it costs about $75 for each 2.5 ml bottle. As Vuity is newly approved for presbyopia, we'll likely learn more and more about this medication as it becomes more widely available in the US. Let me know in the comments below if you would like me to post a video in the future to review my clinical experience with Vuity in my practice. And don't forget to subscribe to my channel so you won't miss any of my new videos. One option for long-term presbyopia treatment is LASIK surgery. A lot of us are familiar with LASIK as a treatment for nearsightedness. But did you know that LASIK can also be used to treat presbyopia? For my LASIK patients with presbyopia, I plan 2 different customized treatments, one for each eye. This means that each eye sees a little bit differently, with one eye slightly more nearsighted than the other, while the other eye sees distant objects more clearly. This technique allows the patient to see both distant and near objects clearly when both eyes are open. Having slightly differently corrected vision in each eye is called monovision. You may have heard or even wear contact lenses for monovision yourself. Having LASIK surgery to create monovision is like having the prescription correction from contact lenses permanently on your eyes. I perform femtosecond laser wavefront guided all-laser LASIK surgery using 2 different lasers. During the surgery, the first laser, the femtosecond laser, will create a very thin flap on the cornea. Then the flap is lifted. And the second laser, the excimer laser, reshapes the cornea to the targeted prescription to create monovision. A possible limitation of monovision is slightly decreased depth perception because one eye is more nearsighted than the other. The exact amount of difference between the 2 eyes for monovision needs to be carefully chosen by you and your eye surgeon. And this is not always as simple as it sounds. It is important to balance depth perception, distance vision, and near vision to obtain the best visual outcome that is possible for your eyes. In my practice, I have every patient who's considering monovision LASIK surgery for presbyopia wear contact lenses for a time to simulate the visual outcome of monovision. And it will only proceed with the surgery if they like the simulated vision. To learn more about the different risks and benefits of contact lenses and LASIK, you can check out this video, Contact Lens versus LASIK. Which one's safer? There is a permanent treatment option for presbyopia available by your eye surgeon called refractive lens exchange. It is essentially the same surgery as cataract surgery for cataract removal. Replacing the crystalline lens not only treats cataracts, but can also treat presbyopia by removing the old stiff lens and replacing it with an advanced multifocal or extended depth of focus intraocular lens implant, or IOL. These special implantable lenses bend the light rays entering our eyes at different focal points, enabling us to have clear distance vision for objects that are far away, clear intermediate vision such as using laptop, and clear near vision for reading cell phones or books. I perform femtosecond laser assisted refractive lens exchange surgery for my presbyopic patients. To learn more about the differences between laser-assisted cataract surgery and conventional manual cataract surgery, you can check out this video. There are potential risks associated with any surgical procedure, so be sure to have an individualized eye exam and consultation with your eye surgeon to find which treatment option is the best one for you. There are other treatments available internationally, such as different types of cornea inlays and laser cornea surgery. I hope you find this video helpful. If you have learned anything new, please don't forget to hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. You can also follow me on Facebook, Instagram, and LinkedIn at Dr. Audrey Tai to learn more about my practice. I look forward to connecting with you there. Thank you again for watching. and I will see you in my next video.